everyone, today we wanted to discuss frozen shoulder, also known as adhesive capsulitis. This is a condition characterized by stiffness and pain in the shoulder joint. It progresses through 3 stages: freezing, frozen, and thawing. During the freezing stage, pain increases and range of motion decrease. The frozen stage involves persistent stiffness and very limited range of motion, and the thawing stage is where the range of motion begins to slowly improve.
So frozen shoulder typically affects people between the ages of 40 and 60 years old, with a higher prevalence in women than men. Certain risk factors make some people more susceptible to this condition, such as diabetes is kind of a higher one up there, that you're 10 to 20% more likely, if you have diabetes, to have an issue with frozen shoulder.
Another risk factor is thyroid disorders, hypothyroidism, hyperthyroidism. So conditions like Graves' disease and Hashimoto's are linked or can be linked to an increased risk of frozen shoulder.
Hormonal fluctuations or changes, especially during menopause, have been associated with increased risk of frozen shoulder. The relationship between hormones, especially estrogen and frozen shoulder, are very complex, but some studies have shown that the hormonal imbalances can contribute to an increased inflammation and fibrosis in the shoulder joint.
Another risk factor is cardiovascular disease. Individuals with heart disease have a higher likelihood of developing frozen shoulder.
So finally, prolonged immobilization, or people just not using their shoulder because it hurts, or due to surgery or fractures or some kind of other injury, can contribute to frozen shoulder more commonly. Now, that doesn't mean just because you had a surgery or an injury, you're more likely to get it. It's just associated with it.
While we can help your frozen shoulder here in the office with the various treatments and rehab that we offer, it's extremely important to address the root cause of your frozen shoulder. We happily work with several of the doctors in the area, and we would love to give you any assistance we can in helping you with your frozen shoulder.
So stay tuned next week as we go over a couple of our effective treatment options in the office for frozen shoulder. If you have any questions or you're ready to get back to performing at your peak, give us a call at 785-842-7325.